My name is Andy Bibby, and I'm here actually just today to introduce our moderator for the second panel of our second day of our conference, Federalism on Trial, Lessons from COVID-19. I'm actually here to introduce our moderator for today, Professor Alan Tarr. Professor Tarr is a distinguished constitutional scholar and one of the foremost experts on state constitutions. He is the former director of the Center for State Constitutional Studies at Rutgers, where he taught for 20 years. This year, we are excited and genuinely honored to announce that Professor Tarr is also the 2020 Visiting Scholar at the Federalism Index Project at the Center for Constitutional Studies. Visiting scholars are chosen on the basis of their lifetime contribution to federalism education, intergovernmental relations, and constitutional studies. Professor Tarr is one of the nation's most respected constitutional scholars and a renowned expert on state constitutions. Professor Tarr, it is a pleasure to see you again, and now we turn the time over to you.
I am delighted to be here, and I've had the opportunity to sit on a number of the sessions and profited greatly from listening to the diverse perspectives. This particular session focuses on state and local leadership during COVID-19, and we have an extraordinary panel of experts participating. I'm going to give a brief introduction of each of them right now, and then I'll just move from person to person for their presentations. Edwin Benton is professor of political science and public administration at the University of South Florida. He's written extensively on state and local relations, on county government, on intergovernmental fiscal matters. He's the managing editor of the State and Local Government Review, and he has served on civic boards in Hillsborough County and the city of Tampa, so he brings a practitioner perspective as well. Alexandra Cockerham is assistant teaching professor at Florida State University. Her research focuses on executive power, not only in the United States, but in comparative perspective, looking at various federal systems, which is a very useful approach for this panel. Alan Greenblatt is senior staff writer for Governing Magazine, one of my favorite magazines. He is co-author of a well-known textbook in state and local government. His journalism has appeared in a variety of publications, including the New York Times, the Washington Post, and Politico. We'll proceed in the order in which I introduced them, so I turn the floor over to Professor Benton.
It's a pleasure to be here today. Just give me a second here and get my what I like to share with everyone on the screen. Again, it's a pleasure to be here today, and I would like to share some of my experiences and ideas, things that I have with regard to things I've written and things that I would written about and explored. And my title is Changes in Federalism and Lessons from the COVID-19 Experience. I'm going to draw, my presentation is going to draw from two things I've recently written. One is already in print, you see on the screen, article in a special issue of the American Review of Public Administration. Another article is forthcoming in State and Local Government Review, where I and several of my colleagues did a Zoom interview with over 30 city and county officials across the nation. What I want to do is look at intergovernmental relations within the overall framework of federalism and look at the various possibilities here. First being federal-state relations, and I call it confusing and conflictual at the time. And just to set the context, and it goes back really to the late 1980s and 1990s. We have seen in particularly national politics, extreme political polarization, hyper-partisanship within Congress and between the executive branch and Congress. And that has help to define what we've seen. The best way I like to describe that is that the political parties, unlike ones I remember growing up with in the 1960s and 1970s, where individuals in Congress would meet across the aisle and agree to disagree, but to make public policy in the interest of the public. But now it's like, I'm going to take my marbles and go home, so to speak. And what it has led to is what I call an exaggerated what we see in Washington, especially the White House, is disorganization, a lack of plan to deal with the coronavirus, appearance sometimes of being out of touch reality, waffling, indifference and concern for the American public, downplaying of scientific information, and sometimes the own again and off again lack of empathy that comes from the White House. So how is that influenced? What has been the experience in state-local relations? Well, if we've paid attention to the news the last few year or less, the federal government has been providing very poor guidance and coordination with respect to healthcare safety protocol. It's off again. You don't know what Washington is going to say next or what's going to come next from the White House. Another thing that we found out when we were interviewing local officials over the last few months is that the federal government has a lot of money. It could be used for testing and tracking of the coronavirus, and for whatever reason, it's just being held back and not being disseminated to the states and then even eventually to local governments. Other things that we have noticed, and has been a byproduct of this super partisanship and polarization, the federal government has offered and provided too little help or to the states, confusion with what comes to the supplying of PPE, other medical equipment, respirators, other medical supplies. It's like we don't know who's on first, who's on second, who's on third. Additionally, the federal government has provided minimal assistance for what we unfortunately may expect, or some places have actually experienced, and that is an overflow of patients with COVID-19 and how to house them and how to treat them, not only to treat them, but make sure they're isolated from other people who could be in the hospital and not spread the disease. Federal-local relations between the national government, local governments, it's by and large has been defined over the years as the Constitution is solid on local governments. The U.S. Constitution really recognizes only two levels of government, the national and the state governments. And so to a certain extent, any relationship that local governments, for the most part, have with the national government is mediated through their state governments. But what has happened with the pandemic and the subsequent recession, it has magnified the role, the critical role on the frontline players who are dealing with the disease on a day-to-day basis. County, city, school, teachers, townships, even special service districts. And so we know local governments, except a period of time, the late 1960s, and democratically controlled White House and the Congress, there was always been very little direct federal aid to the localities. Usually it is sent to the states with some formula to be allocated. So what has that resulted from here during the time of the pandemic? Local governments are experiencing the same problem with regard to the funding that they get from the from the national government and funnel through them to the local governments. On the positive side, we know that jurisdictions that had a population of 500,000 or more, they were cut a check and sent directly to them in the form of, there's actually, I think, $150 million that went directly to local governments to be used for any kind of COVID related services. But for those jurisdictions that are under $500,000, any funding they get is, some people would say, is held hostage by the states, and that money can be redistributed. In our discussions with local officials, many of them were saying some have gotten parts of that money. The state is holding back for fear that it may need that money to cover its own losses and result of revenue. And like here in the state of Florida, where we depend so heavily on the sales tax, we have no individual income tax. That with the economy the way it is, sales are down, and so is revenue from the sales tax. Interesting tactic that we found out with local officials, how they're trying to lobby Congress, and there's been an intensive lobby, assuming they might be somewhere down the road a second allocation of funding, the coronavirus relief funding. That they are lobbying their individual members of Congress, or they're also using organizations such as the League of Cities, National Associations of Counties, even the ICMA, to get some kind of leverage to receive what they think is a larger source of funds. Perhaps one of the more exciting areas is in the area of interstate relations. I call it thriving and cooperative. It's like during hard times, you find states who are experiencing the same kinds of challenges and so forth, that they have a long-standing tradition and history of working with one another in interstate compacts and so forth. This coordination historically has been the coordination and cooperation has been fostered by such things as the National Governors Association, the National Conference of State Legislatures. But without some of the legal ramifications, it makes sense for states to work together because they do face similar challenges and circumstances. And historically, they have worked together, sometimes positively and sometimes not. But we can think of many instances where that's been the case. But what has been the experience of states that are working together? They have, as I said, they have formed a number of interstate agreements and compacts, and these numbers, according to not only data that I've come up with, but studies done by and surveys done by the International City County Management Association, find that the number of these agreements have actually been increasing in the last 8-9 months. Numerous examples with respect to states that are coordinating such things as closing of non-essential businesses, and schools and beaches and so forth. Originally in the states of New York, New Jersey, Pennsylvania, they work together, making sure that reduce the potential for spillovers of the spread of the coronavirus. And there were a number of states on the West Coast that banded together, some in the Midwest, and they took matters into their own hands, and say it this way. States, many of them felt like they were abandoned by Washington, especially the White House and even various federal government departments and agencies. And so it's like, okay, we're on our own now. Well, let's do what we have to do. Looking at another aspect of intergovernmental relations, that of state-local relations, what I've been able to gather and to understand, it's a mixed bag, the relationship between local governments and their states. We all know, and those of us who have taught state local government and politics, and I'm sure in Professor Greenblatt's book, he talks about local governments being creatures of the state. They are totally subservient to their states for their existence, the powers that they exercise, and so forth. And in fact, when I teach state and local government and politics, I frequently use the comparison or the expression, states many times view their local governments as children should be seen and not heard. Don't bother me. And also we know there's an additional constraints brought on by Dillon's rule. If you don't have explicit grant of power in your constitution, it's assumed you don't have it. So within that context, what has occurred? What has been the relationship? Well, local governments that are under 50,000 population and do not receive direct coronavirus funding for yourself, they're experiencing something that the late John Shannon coined as fend for yourself federalism. You're on your own. You have to make do with revenues and so on and so forth. You are out there and will have to do the best you can. However, there's been a lot of friction. Some good relations between the states, but executive orders coming down from governors have been criticized as coming with very little advance warning for them to be able to adapt to it. Lack of clarity. I know here in Florida, Governor DeSantis, in one day, he sent down 3 executive orders, and all 3 of them were dealing with the same issue, and they all conflicted one another. And the city managers and mayors and county administrators were throwing their hands up in despair and saying, "What does he mean? What can we do? What we can't do?" But in our survey of city and county officials in Zoom interviews a few months ago, a number of officials saw the executive orders as being a continuing assault on their local autonomy, and very little flexibility to deal with certain kinds of circumstances that warranted an exemption of one sort or another. And another criticism we heard from local officials about their state government, they were interested in cooperation only because they had to, but not really coordination. They didn't see local officials as being equal partners. They were subservient beings, and that's the way in which they were treated. Finally, the brightest spot is in the area of interlocal relations. And my own research for my article in the American Review of Public Administration, and having numerous in-depth conversations with city and county officials during July and August, we found that these things were very much on the rise. But this is not something new at the local level. Local governments have historically worked together in nothing more than almost informal handshakes or agreements, what we call mutual fire aid pacts. If one fire department has a multiple alarm fire, they will call upon other jurisdictions. And much of this has been local governments, their job is, they would say, as the mayor, I think, of Athens, Ohio, told us, there's no such thing as a Democratic or Republican way to fix a pothole or to catch stray animals. And they're all about providing services, getting it done, and not playing politics with either federal or state officials. But historically, local governments are accustomed to going it alone. Professor Perlman and I at the University of Mexico did a survey back in the 2012, 2013, and that was a frequent phrase that local officials use in having to deal with their state government. We have to go it alone, so we will, and do what we have to do. Experiences from what we and my sources are telling me, there's numerous examples of an upswing in sharing of equipment, information, ideas, and even a lot of informal collaboration and cooperation. Local governments feel like we're in this together. We understand the situation, unlike our state. There's also numerous examples of new intergovernmental, or interlocal agreements They've been consummated, especially in the areas of healthcare delivery, public safety, and other areas that have been impacted. In summarizing or looking at and thinking about the last few days of what I was going to share with everyone today, and thinking about the theme of the conference, I think it's fair to say that well over 200 years of existence, federalism has certainly, as an institution, stood the test of time. There's nothing wrong with the system of government. It can always be tweaked, but it's been there, done there, and done that. Subsequent intergovernmental relations, which flow from the federal form of government we have, has ranged over the years, as Professor Deal Wright and others have given labels to it, everything from conflictual to cooperative to competitive to calculative, whatever, various phrases. And Professor Wright, some years ago, he reminded all of us who study federalism, intergovernmental relations. And one thing I took away as a graduate student when I read his book in 1978 was intergovernmental relations is really our relations. We are not relations between governments. Governments don't have, they aren't living and breathing, but relations rather are between individuals who may occupy a particular governmental position or act as an official. So, and I'll sum it up this way. If there are shortcomings of or disappointments that we may have in the current operation and functioning of the federal structure of government, it's not derived from a failure of the system. Like any system, it could be tweaked from time to time, but any failures or disappointments really can be laid at the doorstep of those individuals who control the levers of government in any moment in time, and things get out of whack. But leave on a positive note, it'll be interesting to see after the election in a few weeks what happens, and if we see a different tenor, a different tone, but especially after not the election itself, but also with the subsequent inauguration in January. Thank you for your time. It was my honor to be here today.
Thank you very much, Professor Benton. I'm sure this will generate some questions during the Q&A period. We turn now to our second speaker, Professor Alexandra Cockerham, from another Floridian from Florida State University, who will be speaking on power and limits of American federalism. Professor Cockerham.
Hi, it's a pleasure to be here today. I'm going to talk about, can you guys all see my screen?
Yes.
Okay, so I'm going to talk about the things we have observed and perhaps learned about federalism since this national emergency that has come to light. So we see this waxing and waning of national and state power throughout history. Some people cite kind of the Civil War as like the height of state power, but then we see the federal government or the national government kind of centralizing power during certain national emergencies, right? Like during the Great Depression, we see FDR really gathered a lot of federal power, right? He established the executive office of the president with his presidency. And then we see after 9/11, the centralization of national power. And what I find absolutely fascinating is that with this national emergency, we see the opposite. We see a central or a decentralization in some ways of power and more pushback from the states and even from localities. And so for various reasons, right, this is a unique situation. I mean, everybody, it's called the novel virus, right? Everybody knows that it's a unique situation, but it's been a unique situation even for American federalism. And so federalism allows us to have different responses to policy challenges, which is one of the great things about being a federalist country, is that we're able to have policy innovation, and we're able to have states adjust their policy based on their landscape in their state. And so the nation's response to COVID-19 is really no exception to this phenomenon. And when looking at any sort of crisis, we look at the chief executive of either the country or the state or even the municipality as the leader in responding. Why do we do this? Because they're often given the unilateral authority to act quickly. So I enjoy studying, my dissertation was on executive orders, right? And studying unilateral action. And so looking at power of governors and power of presidents to respond. And so we see this dynamic between the president having demands that we think the president should be responding in a certain way. We also kind of see governors stepping up and responding through executive order and pushing back with the president, saying, no, it is our responsibility to open the economy when we see fit, not yours. And I will say that, you know, when we are looking, or and like when the U.S. is kind of being scrutinized for their handling of the COVID pandemic, we want to compare the U.S. to other democracies, right? That's the way that we kind of have a yardstick for looking at how we've handled this new landscape. And I think that, you know, when you look at the news and when you look at the media and various people talking about the U.S.'s response, we see people comparing the U.S. to other democracies. But the point is that there's a lot more variables than just the way a country responded. Like when you're comparing the U.S. to a country like Taiwan, who is a very centralized country, right? That Taiwan handled it completely differently than the U.S. and had a different outcome, right? But we are also a federalist system and a much larger country. And so we can talk about the pros and cons of that, right? But federalism has allowed the U.S. to customize their responses by state and even by city. You know, there is no, you know, the federal government sets, as with most public policy, the federal government sets the minimum threshold, but states are free to have stricter guidelines and laws. And the same is true for mayors within a state. And so given the global nature of this pandemic, we want to compare the US to other countries, but we have to realize that there are some unique things about our system of government. I'm not going to go through this whole timeline. I just have it up here for background. In late January is kind of when our story begins for us, at least, as far as President Trump declaring a public health emergency. In late January, not declaring a national emergency until mid-March. And there's been kind of pushback as far as the question of whose responsibility is it to close down the economy? Whose responsibility is it to open back up the economy? And so we see all of this rhetoric unfolding during this time. And really a lot of it has fallen to the states. And given that the states are all facing in some ways the same problem, right? The COVID pandemic, there were differences across states in the timing of implementation, and aggressiveness with which governors pursued their policy with this. There were also similarities across states. Many governors responded to the crisis in a similar fashion, closing schools, imposing lockdown measures that restricted social contact, closing bars and restaurants, implementing a curfew, the gym. I don't have to list all this, right, because we all have experienced this in our respective states. But the point is that even though there are some similarities across states, there are some differences in the timing of implementation, the comprehensiveness of restrictions, et cetera. And so we see that, you know, governors where the virus surfaced early and where there were very large numbers of people affected, like New York, Washington, California, these states acted early. They were aggressive and they repeatedly called on the president for quicker action. Governors in larger, more diverse states, you know, this is not universal, but we see these observations, right? In states that are particularly reliant on either the sales tax or tourism may have been more hesitant to issue unilateral orders that affected the whole state equally. And then we have this other category of governors in small, more rural states that actually took very limited action, like closing the state for like 2 weeks and then opening everything back up, or not really doing much at all. And so there's been a lot of so like I said, our federal system allows us to customize our policies based on certain variables. And some of those variables, like I said, are the severity of the outbreak in the state, but also the state's economy, and even the partisan landscape within the state. We do see some attempts at coordination. So we see like pacts among states, like the northeastern states, agreeing to kind of work together, the western states kind of agreeing to work together. These pacts are somewhat partisan, mostly it's the states of the same political majority banding together. And so this is just a really interesting topic to study and talk about, which I think is so valuable to have a conference on this, right? Because we can talk about what are the benefits of coordinating policy and having a national threshold, and what are the benefits of allowing states to kind of customize their response to this virus, and what makes this national emergency unique to where we value this decentralization of power as opposed to a more centralized approach that we may have seen with other national emergencies. So with regards to opening back up, we see variance with this as well. We saw variance with how states closed down, and we see variance with how states are opening back up. So, various states have taken different approaches. California has ranked counties according to risk level. New York City had remained, had prohibited opening of restaurants until the end of September. And then in Florida, we see in late September, the state is open. It's open again, and the governor has, as I'm from Florida, this is just, but I use this as an example of even like the governor-mayor dynamic within a state. So we see the president and governors pushing against each other with their response to this, but then we also see mayors and governors kind of pushing against each other. And so this at all levels of our federal system has completely just brought to light structural challenges and benefits within our country. So, on September 25th, Florida enters phase 3 based on executive order, and it lifts all remaining state level restrictions. It allows restaurants to open. It does, however, which I find very interesting, and the reason I bring this point up is that this order does not directly address mask mandates, which is left up to the local governments. So at the local level, mask mandates are perfectly fine. However, it prohibits local governments from collecting fines stemming from mask violations, right? So that brings up a whole nother question of enforcement and authority, right? And when you take away the ability to incentivize people to follow a public policy, right, who then really holds the power with that? So in conclusion, American federalism has allowed states to respond to this pandemic in a more piecemeal manner than other more centralized forms of government. And so when we're comparing the US's response to that of other democracies, it's really important to consider the diversity within our country, the diversity of situations across states. So should Wyoming be treated the same way that New York or California or other more populous states are treated, right? What variables and yardstick are we using to gauge when and how things close down and when and how things open back up? And the landscape across states doesn't look the same. And federalism allows us to kind of customize policy, which is obviously, I don't need to lecture you about the value of federalism, right? But it has brought to light some unique circumstances as far as the pushback between state and federal authority and even local authority, and who is best equipped to handle the crisis. And while the president has released guidelines, the states have been the ones really surging forward in this policy landscape, but yet the president is brought under a lot of scrutiny. And I just think that I don't have the answer, but I think that is just interesting complexity that should be brought to light, is like, why are we focusing on President Trump? Why are we comparing the US to other very centralized forms of government? And then saying that, right, we just need to be careful about talking about, well, we should be looking at how the states are handling this crisis, because that is who's handling this crisis for the most part. And so I guess in some, federalism has allowed this diverse approach, and it gives us the ability to look at the measures that are most effective and least effective. And and bring about some, this pandemic has brought about some complexity with our system that I think other national emergencies have not necessarily brought to light. And that's all.
Thank you very much for your presentation. I was particularly struck by the relation between state and local governments, and oftentimes there are differing perspectives regarding what sort of policy should be pursued. I think we'll get some sense of this as well from the next presentation by Alan Greenblatt. His presentation is called States and Localities During COVID-19. Thank you.
Yeah, thanks very much. I don't have slides, so you have to look at me. I apologize for that. But it's a great time to do a conference on federalism because the country is getting an education on federalism. I mean, this is the specialist audience. Most people don't think about federalism. And a lot of people don't have a great sense of the separate responsibilities and overlapping responsibilities of states, localities, and the federal government. But this year has taught us a lot about it. Due to the fragmented nature of the public health response and also the combative nature, and certainly in terms of federalism of this president. So I'm going to talk about all that. I'm not going to talk a ton about the public health response, but more kind of a state of federalism 2020. If I may, I just want to pause for a moment here at the start and acknowledge the passing of Dave Robertson, who was a professor at the University of Missouri, St. Louis, and the author of Federalism and the Making of America, and somebody with whom I had many fruitful discussions about federalism with over the past decade, and he unfortunately passed from pancreatic cancer this month. So I wanted to acknowledge that loss to the field. Moving on to my talk, I want to be a little bit more blunt than my colleagues and just say that we can talk about federalism and the pluses and minuses, and as the president says, it is what it is. This is our system. But I think it's important to say it's been a terrible failure in terms of responding to this pandemic. The pandemic is a global problem. The idea of having states and cities have their separate responses is frankly idiotic. Because this is something that requires a more unified response. I think in the last panel, they talked about the need for coordinated communication. That is public health 101, is that everybody speaks off the same page about the threat. And that has obviously not been the case this year. And in terms of states and localities experimenting and learning from each other, that has not been the case this year. States have refused to learn from each other, perhaps in large part due to polarization. And, we talk about the laboratories of democracy. Now we clearly have red labs and blue labs. And in a situation where we need actual laboratories, we have partisans refusing to learn from each other. There is a study that came out yesterday from Columbia that estimated at least 130,000 Americans died needlessly due to the poor political response to this pandemic. We have twice the death rate of our neighbors to the north in Canada and 50 times the death rate in Japan. I'm sure you saw many snarky comments a couple weeks ago when we had the super spreader event at the White House that there were more cases at the White House alone than in countries such as South Korea or Vietnam that have had coherent responses to this pandemic. So just to editorialize at the start, it's been a failure. So how did we get here? So public health is one of the most fragmented or federalized functions of government. We don't have a public health system in this country. There's really no federal agency in charge of public health. The CDC is kind of like the FBI of public health. It's sort of a detection and warning system, but it doesn't really have the capacity to deal with public health emergencies. It's not how it's set up. We had a very bottom-up response to public health throughout our history, starting in the 1820s with New York City creating public health, a board of health, they called in those days, and then the first state health department in Massachusetts in the 1840s, back in the cholera and yellow fever epidemic days. And then the CDC is not created until the 1940s, so a full century after the first state health department. The CDC was an outgrowth of the World War II anti-malaria efforts, which is why it's in Atlanta. So over the years, public health has kind of adapted, this sort of very federalist model where the CDC sets the tone and the leads on communication and provides guidance to state and local health departments that do the actual work. And with the state and local health departments putting up the money, borrowing where they can from other functions, knowing that the federal government will come in with resources later. So that's what happened with our more recent outbreaks such as Ebola and Zika and H1N1 flu. CDC took the lead in state and local health departments. We're all kind of rowing in the same direction. You may remember that we did not have 200,000 deaths from any of those events. We did have it this time. Professor Benton talked about the phrase "fend for yourself" federalism, which happened to be the phrase on the cover of the first issue of Governing back in 1987. At the time, as he suggested, it was about not the federal government not giving resources to states and localities, letting them be on their own. That's what happened with COVID. I wrote down this quote from March 19th, which, as you may recall, was right when things were really shutting down in this country. President Trump said, governors are supposed to be doing a lot of this work, and they are doing a lot of this work. The federal government is not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk. And the next month, his son-in-law, Jared Kushner, said, the notion of the federal stockpile of ventilators and other medical equipment was supposed to be our stockpile. He said, it's not supposed to be the state stockpile that they then use. So attitude about the idea of what the United States are and who we are and whose stockpile it is, but it's factually incorrect. And of course, they took down the information of how the stockpile was created as a resource for states because the federal government had more resources and states are not supposed to be on their own because we allegedly had learned from prior public health crises. Having said all this, God bless federalism, because if we didn't have federalism, we might not have had any response. We have an administration that has not taken this pandemic as seriously as needed. I think that's fair to say. So we did have states act in the absence of the federal leadership. Some prior speakers have talked about the regional alliances or interstate compacts that states formed. Again, curious idea of United States within the United States. Yesterday, we had the CDC having a press conference for the first time in 8 weeks. The CDC has been sidelined throughout this adventure. They've certainly made mistakes on their own with their desire to come up with their own tests rather than using those from abroad. But the CDC has been sidelined and contradicted repeatedly by the White House. And we have this White House coronavirus task force, which has given very conflicting guidance to states. And certainly, the various CDC, FDA task force messages have been contradicted repeatedly by President Trump. So this, this is my view of things, how we ended up with such a disparate response. And as I mentioned earlier, we have the blue labs and the red labs. We have Republican states by and large, Republican-led states by and large, being much more laissez-faire, and Democratic cities and states being having much more restrictive measures. And, to some extent, I said, people refuse to learn. That's obviously not entirely true. But we've learned more about whether services are a danger versus airborne. We learned that lockdowns are, ultimately not a successful strategy. But, at the moment, if your school is closed, you're probably living in a Democratic area, even though your coronavirus case load may be lower. And the converse is true. Schools are open where cases are higher, for instance, in parts of the South. So, and we had different states say, well, we don't all need to respond the way New York did. We don't have that many cases. Well, guess what? The virus found them. And so then we had Texas and Arizona and Florida in the summer having terrible numbers, and other states still said, well, it's not a problem here, so we don't have to do anything. And now we have the highest per capita case loads in the Dakotas and states like that, and it's all over the country now. Now we do have actually, for the first time, a national problem where essentially every state is in bad shape just as we go into the fall. So anyway, I sort of wanted to step back from the public health and just look at how we ended up with this polarized, partisanized, hostile federalism. In my time covering states and local governments, we certainly always have had venue shopping with interest groups looking for a level of government where they can achieve their policy goals. So for instance, if you can't pass minimum wage, which Congress has not done for a couple decades now, it's been very effective to turn to the states and have state level increases, and also through ballot measures get minimum wages increases. Then you could go issue to issue and find progressives and conservatives have looked for the level of government where they're most likely to be successful. What's striking to me now at this point in our history is that we now have governments themselves, or political, the people in government themselves are sort of doing this venue shopping themselves and looking for ways of getting their own policy agenda. So not just interest groups, but the actual actors. So a very striking example I thought was President Obama working directly with mayors on issues such as early childhood education and the My Brother's Keeper initiative on young Black males, minimum wage also. Since he couldn't get anything through Congress, he worked with mayors. And then in response, you had, this past decade has been a largely Republican era at the state level, and you've had red states preempting their localities on lots of things, lots and lots of things, plastic bag bans, minimum wage increases, paid sick leave requirements, and on down to, it's become habitual now, so it's practically everything. Our friends in my fellow panelists in Florida can talk to you. That's been one of the most active states where localities are told what they can and cannot do regularly by the state governments, and up to, and of course, including the pandemic, as they noted. There's preemption of local restrictions. Again, countervailing force, this idea that pandemic encourages experimentation. If you are not allowed as a local government within a state to deal with your case counts as you see fit, then that cuts off experimentation. So at this point, I wrote an article this year arguing that states, in not Congress, have become the leaders of the opposition to the administration in power. That's a bit glib, but I think there's some truth to it. And when we think about federalism, we have to remember that the founders thought of states as a bulwark of liberty against centralized power. Obviously, there was we had the Articles of Confederation to begin with, but even as they did the Constitution, they set up the Senate to be elected directly by states, which of course we've done away with. Jefferson said the states were the true guardians of our liberty. Just this idea that we think of the third grade version, that you have the judiciary and the executive and the legislative branches balancing each other out, but the states also balance each other out. And in our current time, this has become a very combative oppositional force. So it was quite striking during the Obama presidency how often state attorneys general, Republican state attorneys general, would sue the administration. Greg Abbott, who's now the governor of Texas, as attorney general, would joke that my job is like go to the office, I sue Barack Obama, and I go home. Certainly his state and in Oklahoma and many others sued the Obama administration repeatedly on things like the Clean Power Plan and, of course, the Affordable Care Act. And, of course, they are actually still at it since it's a Republican AG case. It's going to be before the Supreme Court next month on the Affordable Care Act. It was really striking during the Obama era. It used to be very rare for more than a single state, so to have two or more states at a time sue the federal government over anything. Back in the Reagan presidency, it would happen once or twice a year. It was considered shocking at the end of the Obama presidency that it happened a dozen times a year. We had these multi-state lawsuits against the federal government. And now it's just perfectly ordinary. So we've already had 134 multi-state lawsuits against the Trump administration in its nearly 4 years in office. For that number, I am obliged to Professor Paul Nolet of Marquette, who wrote a book called, like this conference, Federalism on Trial. So the state AGs have become routinely opponents of the president. And certainly with this president, you have Democratic attorneys general suing at the drop of a hat on things like the Muslim travel ban, the emoluments clause, the census citizenship question. You could just go on and on and on, like say 134. And of course, individual state AGs in California and Massachusetts and New York have sued repeatedly. Maura Healey, the Attorney General of Massachusetts, put out a video on social media last month bragging about suing the government over the U.S. Postal Service and the apparent sabotage there, for one of a more neutral word. And she promised to prosecute the president if he tries to cheat and steal the election. And so this is now, a routine political stance for a state AG to be that directly oppositional to president. So for governors, it's a trickier matter because they need things from the federal government. And, Trump certainly understands this. And in the spring, when he's going back and forth between his desire to let the governors handle the pandemic and his desire to tell them what they could or couldn't do, you may remember in April, he said he was going to order them to reopen the states. And of course, he doesn't have the authority to do that. But he then said the governors will be very, very respectful of the presidency. In other words, they need things from him. Joe Biden was sensitive toward this. It came out, he had some meetings with governors a couple weeks ago where he said it was okay for them not to endorse him because he didn't want them to lose resources and support from the federal government that they need to deal with the COVID outbreak. And, we've seen governors like Gavin Newsom, who is very critical of Trump at times, saying nice words to Trump, knowing that flattery is key to relations with this president. But of course, we have the federal government pushing back against these states that are questioning them. I mean, we had we've had lawsuits from the Trump administration against California on its various greenhouse gas initiatives and things like that. They won't. The EPA has pushed back against Gavin Newsom's plan to have all new cars sold in the state be electric by 2035. Told him it was illegal. They've been back and forth on the wildfires, which I think was a telling moment. Trump continually over the past couple of years has blamed California for not managing its lands well and blaming California for its fires. And, Gavin Newsom has told him to his face, it's mostly federal land where they're having problems with the underbrush and whatnot. And last week, the administration refused California's request for a disaster declaration for the wildfires, saying they didn't rate, even though they were of record size. The administration then reversed its position by the end of last week, since it helps to have the Speaker of the House and the top Republican in the House be from California. But, this is what was warned about during the impeachment trial, that we're all Ukraine now, that favors from the federal government may depend on political whims of the president. There's been areas of cooperation. I interviewed Professor Benton last year for a story I did about how Trump has found common cause with counties where Obama worked with cities. Trump's vote, of course, is not in cities, but in counties. So obviously, everybody lives in a county, but less populous counties. And, they found common ground since counties don't like regulations and this administration doesn't either. They were able to work together. And again, like I said, this point I'm trying to make that if there's, you want to encourage other levels of government to do what you want, but now we have this mixing of responsibilities where if the states or localities won't do what they want, the feds will just go ahead and do it themselves. And this most dramatically this summer with Trump turning sort of the Department of Homeland Security powers inward and sending federal agents to patrol in Portland, Oregon, and some other cities with protests. In Portland, some of the local police were deputized as federal agents. I mean, we're really getting to a complicated mix of federalism now where local cops are federal agents. And meanwhile, you have this constant pushback with Larry Krasner, the district attorney in Philadelphia, threatening to prosecute any federal agents who came to keep the peace in their town. And I'm speaking to you from St. Louis, where we've had federal law enforcement officers and state officers brought in to target violent crime in the city. So we have this total mix. It really makes it hard for people to know who is responsible. Some of this we've seen in the past during the Bush administration, George W. Bush, the second Bush. We had U.S. attorneys prosecuting death penalty cases in states where the death penalty had been abolished or was effectively moribund. But now we have, much more of the feds just taking local law enforcement in their own hands. And the flip side of it is, that they say that the cities are not run, they're not run well, and they're not safe. And there's, we now have this term, which is apparently a term of art in the federal government, anarchist jurisdictions, where the Department of Justice has determined that Seattle and Portland and in Washington, D.C. and New York are anarchist jurisdictions. And, when the federal government, when the Trump administration was suing states and cities at the beginning of the administration over sanctuary city policies, it sort of became clear. I mean, it was known already, but you can withhold federal funds from lower levels of government that don't cooperate with your policies, but they have to be basically in the same area. There has to be some connection. You can say, if you're not going to do what we want on law enforcement, you won't get law enforcement funds, but you can't just say, we're not going to give you, highway money if you have a sanctuary city policy. But this seems to be where we are now. Certainly the administration is trying. The Federal Transit Administration recently announced a $10 million fund for public transit agencies to experiment and learn and figure out how to mitigate the spread of coronavirus on buses and trains. But they said that the MTA in New York, the largest transit agency in the country, is barred from applying because New York is an anarchist jurisdiction. And we found out this week that the administration is thinking about withholding millions of other dollars for coronavirus relief, HIV treatment, newborn screenings, and other programs that have been deemed anarchist jurisdiction. And this is language now being taken up by some of the Republican governors, and certainly the policies are being taken by Ron DeSantis, governor in Florida, and Greg Abbott, who I mentioned in Texas, who are talking about withholding all types of funds from cities if they cut or, quote, defund the police. And it's not strictly a partisan, red state versus blue city phenomenon, although that's been the dominant thing in preemption this decade for sure. Andrew Cuomo recently said, the governor of New York said, with cases rising in New York City, that he would put state police in charge of COVID enforcement. It's sort of the opposite of the last speaker talking about DeSantis not letting localities have mask fines for mask failure to wear masks. Here the state is saying we will take over enforcement if you're not doing a good enough job. And of course, the main thing is here we are with the stimulus debate, sort of a kabuki debate at this point. I'm pretty sure it won't happen, right? Certainly not before the election, and probably not until the new year. And the biggest holdup is the money for state and local governments, which of course the House Democrats want, but the president refuses. And he tweeted just yesterday, Pelosi and crying Chuck Schumer, blah, blah, blah. Their primary focus is bailing out, all caps, poorly run and high crime Democrat cities and states. So we're at this stage where, when we need cooperation most, because we do have this nationwide / global problem of health, we have not only no cooperation and no coordination, we have conflicting messages and open hostility with parts of the country that did not vote for the president now seen as somehow not part of the country worth aiding, whether for disasters or fiscal relief or what have you. So I think you heard in this conference yesterday, I don't know how to pronounce this fellow's name, but Greg Galeshauser co-authored a paper this summer talking about punitive federalism. And I think that's where we are right now. We don't have cooperation. We have a punitive combative federalism. And so I think the next panel is going to talk about the future of federalism. So maybe they'll tell us where we'll be in a new administration. So with that, I will stop talking, and I appreciate your indulgence.
Thank you very much. We have a lot to talk about, and the questions are flooding in. Some are addressed to particular members of the panel. Why doesn't everybody put their cameras on so everyone can be seen? And I'll just go through them, and if there's not someone to whom they're aimed, please feel free to jump in with your own comments. And even if it's aimed to someone in particular, we would welcome further comment from other members of the panel. So, question number one, this is for Professor Cockerham. Do you think the customized diversity of state policy on COVID consistently intends to respond to the needs of state communities? How much is the customization partisanship rather than an attempt to find a solution?
So I think the answer to that question, it's a great question. I think the answer to that question depends on the state and the, not even the state, but the actual like situation. Like, I think sometimes, you know, the goal of federalism is obviously the former part of that question. The outcome, it seems, has become very much the latter. So it's absolutely very partisan. Like other countries like Canada, it hasn't gotten so partisan, right? So, you know, I think my presentations were kind of talking about the goals of federalism and this idea of almost like what are states' priorities. So Florida and Texas, we see their priorities for better or worse, probably worse, right? Based on the state's economy and their use of sales tax, and right. So that part, it is diversified and customized. Whether or not that's for the betterment of the community, I think we have to, that depends on what yardstick we're talking about. And I think the yardstick that is used changes according to party. So that is a loaded question, a very complex question, but I think that is my answer.
Anyone else like to contribute on that topic?
Yeah, I'm just tempted just to say, I mean, you know, the balance between the economy and the health. I mean, if you go back and look at the history of public health in this country, in the Spanish flu and other epidemics, the arguments that we're having now have recurred time again. This argument about individual liberty versus the collective good, or commerce versus health. These themes have come up time and time again. This is not the first anti-vaccine movement in our history, anything like that. And so, I mean, certainly there is a balance to be struck between shutting down the economy, shutting down schools versus health. But what's striking to me is that there is, like I say, this partisanship that keeps even, you know, for real learning from happening. So, you know, if you're a Republican governor, you may care more about the economy, but it does not hurt your economy to have a statewide mask mandate. And so the Republican governors have been slower than the Democratic governors on this because it has become a culture war item. So just the other day, we had Doug Burgum, the Republican governor of North Dakota, which has the highest coronavirus per capita rate right now, crying at a press conference and asking people please to wear a mask, but refusing to impose a mandate, where we've seen, you know, clear evidence from this pandemic that mask mandates change numbers. And, you know, even in a state like Arizona, where originally there was preemption, when the governor there allowed local governments to do their own mask mandates, we saw positive effects from that. So again, I'm sorry to be so negative. But just in watching this over the course of the year, I mean, it does seem to me we're not having the lab of democracy effect we want, where people will learn from each other, just because it is become such a partisan issue, like every other issue in our public life.
Yeah, I'll piggyback off of that, Dr. Greenblatt. I'll also say, I think that this, oh, sorry, this federalist kind of system, where we see federalism kind of allowing people to learn from each other, like you're saying, this lab of democracy, we're not seeing that because the solutions to this wicked problem are divided into two choices, right? Like this is the Democrats' approach, this is the Republicans' approach, and so that I think stifles the ability to have like creative public policy because it is so polarized.
Yes.
The next question actually goes to this question of learning from one state to another. Person writes, there's a great deal of diversity within states or among states. How can states learn from one another and their responses when each has differing circumstances? Is the problem just the polarization, or is there a more general problem with this learning across jurisdictions?
Is that a question for me? Or?
If you're brave.
I'll try. Well, so this whole idea of policy diffusion, I mean, with any public policy, states have different circumstances. Coronavirus is no exception to that, right? So, I mean, yes, but the variables with which it varies is not, I mean, there aren't that many. I mean, it's like, when did this virus hit your state and how severe is it, right? But states have become more and more alike with the severity question, right? I mean, it's becoming more and more severe across states. So yes, they're different, but that doesn't mean that, right, we can't learn from other states and then adapt policies to the conditions in our state. But yeah, I mean, it's a great point. You know, states have very different economies, and it certainly is a cost, right? The shutting down the economy, we can't deny that. I mean, it's a cost. It's a societal cost, and that cost is more costly in some states with some economies than it is with others. And that's what economics is all about, this cost benefit.
Yeah, if I can just comment also, there's no question that there's real-time information sharing happening at all levels. There are constant Zoom meetings like this among governors, among public health directors. I mean, you name an actor, secretaries of state, whoever, they know they're dealing with common problems. We're talking about the differences, but they know the virus infects people the same way. That we know it does not really have to do with density at this point, and that no state is immune. They all know this. But then what they take away from it, I mean, they certainly learn from each other. And, you know, certainly I was making a little speech in favor of mask mandates earlier. That has happened where, you know, governors who are reluctant have come around due to the experience and the data they've learned from other states. But it's imperfect. I mean, you know, certainly if you talk to a public health director, they will often tell you, you know, when you go off the record about the political waters that they're having to navigate. So anyway, but just to answer this question, there's definitely ongoing, constant information sharing and therefore policy diffusion in this area.
That leads us directly into the next question. Person writes, in light of the federalism breakdown in response to the pandemic, what steps should be taken to prepare for future national emergencies?
What happened was we were not adequately prepared for this pandemic, but what preparations there were tossed out. I mean, obviously it's become kind of a Democratic talking point that the Obama administration, having learned from Ebola and other experiences, made an actual pandemic playbook, which was ignored by the Trump administration, and pandemic officials tasked to the National Security Council were then shifted away, and it just was not a focus. I mean, clearly, you know, it seems like a pretty safe bet at this point that Biden will be elected. He'll take a different approach. And I really don't have any doubt that there will be not a 9/11 commission, but there will be some kind of real grappling with what went wrong because our failure is so clear. So I think lessons will come out of that. I think, you know, people in public health will tell you we knew what to do, and the tragedy is that we didn't do it. But you know, there'll be a reckoning, and you know what typically happens with public health is there's a boom and bust cycle after 9/11 and so forth. They get a lot more money, but there just has not been sustained funding for public health. Public health gets 3 cents out of every healthcare dollar. The attention is always on individual healthcare. So to me, that'll be one of the major questions, is whether there is any kind of real sustained funding for public health. There was a blue ribbon panel on this last year convened by the Robert Wood Johnson Foundation that thought $4.5 billion would be a great annual appropriation for public health from the federal government to states and localities. At the time, they thought it was wishful thinking, but think of what a bargain $4.5 billion sounds like after this multi-trillion-dollar pandemic. So not really answering the question because I don't have specifics, but I will say I'm sure there will be some kind of structural reforms coming out of this pandemic.
Although I want to add before our time is up that federalism is a challenge for almost any national emergency. I mean, we could talk about natural disasters and FEMA and the mess, right? And so I don't know how much change will come about because I don't think that this is a problem that's unique to public health. I think the structure of federalism and having decentralized power is always a struggle when we need power to be centralized in certain situations. It creates disorganization. So it's not just a public health problem. It's a national emergency problem with federalism.
That's absolutely right. But, we do have FEMA, which plays kind of a CDC role of coming in after the fact to help states and localities and giving them guidance while they're dealing with. But the other thing is states have become much better at doing real interstate cooperation on disasters. Whenever there is a disaster, you have responders coming in from other states, you have expertise sharing on the ground. And so in disaster management, we've had great improvements. And maybe that will become a model for dealing with public health.
Actually, the next question says, why do you think COVID pandemic is different from other national emergencies? If indeed it is. Disasters you talked about in which we have figured out some way of responding effectively.
Yeah, I mean, I don't know, it's kind of this in-between thing because you have like 9/11, which kind of is obviously a national concern, and then you have like natural disasters that affect states and maybe 1 or 2 states at a time, but it's certainly more localized. And then you have COVID, which started out more localized and so it's kind of like, it's the same but different. It's like, so it's a hard question.
Well, I would chime in here and say that the framers of the Constitution and even the observations of Tocqueville, who he wrote extensively about the great American experience. He said one of the beauties of federalism was it would allow the constituent states to respond innovatively, creatively, out of the box, so to speak, to various situations. But as we saw during the Great Depression, there was a need when state and local governments were financially destitute, were unable to mount and meet the challenge on their own. We had the federal government come to the rescue, so to speak, and coordinated things and provided money as the federal government is doing now in extraordinary times. So in that sense, you went from Tocqueville and others said, let us do our own thing in our own states, depending upon our culture, our values, our political beliefs. But there's a time for centralization of authority. Roosevelt and the New Deal Democrats met that challenge in a way that was appropriate. The need is as great now as it was during the Great Depression of my parents and my grandparents, but there's been a willful neglect from Washington, and I'll say Washington, not necessarily the White House, but in dealing with it, it's like willful neglect. There's a time and a place for federal authority with still respect for states' rights, but it's like Washington, and especially the Trump administration, just looks to the way and says, I don't want to be involved. Or or early on, the president said, I'm in charge. And then he says, no, it's the state's responsibility. It's got to be one or the other. Make up your mind. And we don't need someone waffling or an institution waffling. And I think it must have sensible, in-tune politicians that know when it's time to contract power and to disperse power. But it's though everyone is asleep at the switch, and let someone else do it.
Yeah, it's a fascinating question just because what you were just saying, Professor Benton, is, we have this argument about the federal bailout for states, so-called bailout. I mean, if we want to have all our bars closed, it would be a lot easier if we had a federal program reimbursing bar owners and employees, right? But we don't have that. And now we have this, the federal government can borrow money and the states can't, they can print money, I should say. So that's where they should be stepping out, as they have in prior recessions. But we have actually opposition to this idea, even from some governors and state legislators, including the governor of Utah, who I interviewed recently, since we're at a Utah conference, who felt like it was an unfair bailout of mismanaged blue states. He had built up a healthy reserve fund. But getting back to the original question of how this differs from other disasters, I think we shouldn't ignore time. If a hurricane hits, the impact is immediate. The hurricane moves on. And of course, it takes months to rebuild in that area. But here we have the whole country. We have the first time every state under disaster declaration, and already for multiple months and certainly for months to come. And so the initial response was to let governors run the show and let them issue executive orders and emergency orders. And over time, we've seen legislatures push back against this. They don't want to be sidelined for months the way they would be for a 4-day disaster.
There are a couple questions here focusing on how one compares the response in the United States versus response in other countries to the COVID. And also, someone questioned, given the fact that the states have borne the heavy responsibility, is it useful to compare what's been done in the states to what's been done in other nations?
Yeah, of course it's useful to compare. We failed. We can see it. This is not abstract. We know it could be done better. We know there are methods that would have kept numbers lower. Of course, numbers are rising again in Europe. And we are a bigger, more diffuse country for sure. But other countries, whether they were democracies or not, whether they are centralized or not, they had coherent national strategies, and they weren't all the same, whether it was emphasizing universal mask wearing or aggressive testing and tracing, what have you. We have not had any kind of national strategy to deal with this. And it's a scientific model, which I think, federalism is always wonderful. In my experience covering politics, people always care about the issue at hand more than federalism. I think that's more justifiable in a situation like this, where you're dealing with a medical and scientific problem and not, a policy argument. Anyway, and we've seen, states doing better. The states that were hit the worst initially in the Northeast now are doing better. Cases are going back up in New Jersey, but the positivity rate in New York is about 1% on, how many people get turn positive. It's about 1% in New York versus, 20% in some other states, and even higher right now. It's useful to see what is working in other places. And the tricky thing about a virus is, until we have a vaccine, you're not, people may still get it later, but delaying infection is useful. We've already seen in these months improvements in treatment and a lowering of the death rate. So if more places did the right things, we would have fewer deaths. So yes, it would be worth learning from places that work, whether here or abroad, in my view.
In addition to that, if I can add on to what Alan was saying, is that too often we have people at all levels who are playing politics with a very serious deathly illness. And opening up the economy when your rates are high or opening up schools is absurd. Just because it will get you votes, you'll think you will get you votes at the next gubernatorial election or to the U.S. Senate or wherever it may be, you have to put the best interest health-wise of your constituency as your number one priority. We would all like to get back to work. We'd all like to get back to normal. But we have to practice responsibility as individuals and as governments and as political leaders and do what is right. Even I saw a small hometown of mine in South Carolina who recently said, well, we're going to have to wear masks. We're going to cancel the Christmas parade. Well, we don't want to have to do those kinds of things, but if it will get us back to where we need to be and save lives, we do it. But people have to have the political fortitude to say we have to do what is right. But we're in a dilemma we've never experienced before, although it's no excuse for not doing the right thing. We've never had a recession that was driven by a health pandemic. And until we get a handle on the coronavirus, we're going to be wallowing in this situation for years to come, maybe decades to come, if we don't take care of what is top priority is the key, the linchpin for everything, the economy ever coming back.
Second to last question. It says, do you think this pandemic would have been handled differently if it wasn't an election year?
I don't think so. I think things had happened and maybe an inopportune time, a fortuitous time. I think once the pandemic began to spread and things got worse, I think people tended to politicize it. But I'm not sure the folks in the White House, they're still asleep at the switch. I don't think they are thinking about the next election. I mean, if I were a President Trump, I would have taken advantage of the situation and said, I didn't cause it, but I'll get you out of it. I know how to bring the nation out of it. He could have taken advantage of it being the incumbent, and he didn't do so. And it took Vice President Biden a long time to finally figure out, even if I had any kind of plan, some kind of plan, just get me a plan, that it could be politically viable. I'm not sure that the folks in Washington, those in office and those who want to be in office, actually have a good idea is what they need to be doing. They're doing what they have to get elected, but I don't think they can connect the dots, quite frankly.
I think this president is a short-term thinker. I don't think it being an election year is what drove his thinking. I think this was something he didn't want, and he wouldn't have wanted it in 2017 or 2018 or 2019 either. And he's not someone who, every crisis of his presidency up till then was of his own making. And now he's been handed something he had to deal with. And, I think Professor Benton is right that, you're talking about finding the political will. I mean, the political will should all be on the other side. If Trump had come out even as late as the summer and said, I alone can fix it. We're going to beat this thing. We're going to, really do the PPE and the masks and all these kinds of things. We're going to shut down the economy for 2 weeks. We're going to ask everybody to stay home for 3 weeks. We're going to eliminate the virus. He would have been given huge points for trying, as every governor who took this seriously has seen a spike in approval ratings. And also with the stimulus, to me, it's bizarre that, you want to prime the pump before an election, even if there's not high unemployment. But, there's just this refusal to do so. And the Republicans are, returning to their deficit hawk stance. But anyway, it's become very politicized, but I don't think it's driven by the election year. I think it's driven by this particular politician.
I would say the election magnifies this a bit. I mean, this is like a classic collective action problem where we would all benefit from a group action on something, and we have a hard time incentivizing individuals to do things they don't want to do, or from acting selfishly, for lack of a better way to phrase that, right? And so, I mean, during an election year, it's even more salient, right? I am making you do what you don't want to do, and making people maybe view it as making you lose your job or take a pay cut to do this thing that you don't think is important, And so I think in election year, what's the politician's number one goal oftentimes? To get reelected. They want to piss as few people off as they can, and it certainly has made it more complex.
There's something to be said too, that sometimes people just happen to come along at a time where leadership is needed, and they come forward, whether it be a Winston Churchill or a Franklin Delano Roosevelt or a Mahatma Gandhi or whomever. But we're in a I'm afraid in a country and in a world where, if I can quote the title of the book by David Halberstam, I'm looking for the best and the brightest, and I don't see anyone around who can fill that void.
Final question. The conference, of course, is focused on federalism on trial, COVID-19. And the question is COVID-19 especially suited to spur debate about the value of federalism? Is this a proper thing to use in testing the value of federalism?
I mean, most people have a problem with government policy for, like, I tell my students, like, for 3 reasons. 1, you don't think this is a problem. 2, you may not think this is a problem that government should solve. Or 3, you don't like how government is solving it, right? And so this kind of falls into the third, where it's clearly a problem, and government, it is their job to solve collective action problems, right? But there's debate about whether or not we think that government, most people don't like how government's doing it, whether the scrutiny be on the president or a particular governor. We don't think it's being done well. And it's certainly not having if we were to evaluate the policies, they're not having the outcome we want them to have at containing the virus. So federalism, this does give us an opportunity to kind of bring to light some weaknesses in our system or strengths in our system. I'd say weaknesses, right, with the disorganization of the ability to act quickly in time of crisis and be decisive and nip this crisis in the bud before it becomes out of control, as we've been talking about, right? And it has become out of control because we had an inability to centralize power and make a decision at the beginning. And so it's allowed for kind of too many decision makers at the table to the point where we're having a hard time coordinating.
Anyone else like to add to the perception?
Well, like I said at the start of my talk, this was a stress test for federalism, we as I said, usually in normal times with a public health crisis, the CDC would play a convening role. The state and local departments and actors would have significant authority, but there would be kind of a centralizing guiding principle and strategy, and we didn't have it this time. And I think it's a big question with, like, say, I'm reasonably confident Biden will be elected. I'm sure he will take a more public health driven approach than the current president, but whether he could put Humpty Dumpty back together again, I don't know. I think that we'll continue to have resistance to a lot of ideas from Republican governors, Republican legislators, and Republican voters, because this issue has become so polarized, even with lives in the balance.
Thank you very much. I think this has been an illuminating panel for everybody who's been involved, and I'm sure for the people who have been giving us questions as well.